Hi, I'm Carol Winchester, the president and founder of Dysphagia Management Systems, or DMS, and welcome to DMS Cares. Here we're answering questions today about the coronavirus and dysphagia and how it affects the body and the five systems of dysphagia. So, what I want to do is go through the five systems and just give you a couple of suggestions. If you're suffering from this or if your dysphagia is getting worse, because you have this virus, you have the flu, you have a bad cold, what can you do? First of all, let's talk about what needs to happen when you swallow. When you swallow, five things have to happen. First of all, muscularly, you have to be able to chew. You use your lips, your teeth, your tongue. You get the food chewed and you pass it to the back of the throat where your pharynx has to squeeze the food to go down into the esophagus. It's a very coordinated movement. When you're tired, because you have the flu, you have a cold, chewing becomes more difficult. So, what can you do? Well, simply put, eat foods that require less chewing and less manipulation. You can soften your foods. And I think most of us do this anyway. When you get a cold, what do you crave? Well, you crave foods with rice, or you eat soup, or you eat toast with butter and jelly on it, or you automatically reduce the texture of your food. You're not hungry for a steak or for fried chicken that require a lot of chewing and an effortful swallow. So, muscularly, then, what you can do is to look at the texture of your foods. How hard is it for you to swallow given your circumstance or what your therapist has recommended? And go with a softer texture. Downgrade your diet yourself, much like you're probably already doing. The next system is the neurological system of dysphagia. And the neurological system of dysphagia is what tells the brain, hey, there's something coming. It's your being able to feel, is it hot or is it cold? And does it require a lot of chewing? You feel it as it's in your mouth. You feel it at the back of your throat. You feel it as it's going down your pharynx and into your esophagus. So it's all of the nerves working together to give your brain the signal that it needs in order to be able to swallow. The next system is the respiratory system. The respiratory system and the neurological system pretty much work together in that the respiratory system, when you swallow the saliva that's in your mouth, you had to hold your breath for 1 to 2 seconds. You do that every single time you swallow because when the food and liquid comes down, your vocal cords have to close. Otherwise, the food or liquid as it passes over would fall into your airway. We also have this thing called your epiglottis that flips down like a lid on the bucket. Here's your vocal cords that close. The epiglottis flips down. All of that happens in order to protect your airway. So, neurologically speaking, you have to feel that it's coming. Respiratorily speaking, you have to be able to hold your breath in order to be able to protect your airway. So, what can you do to be able to feel it more? Well, did you ever notice when you have a cold, the things that you like maybe you want to have water with ice in it because you're going to feel it more? It cuts through all of the secretions. Which reminds me, what is the deal with the secretions and how does that diminish your swallow? Well, it takes the neurological system and it affects it in this way. If you were to put Vaseline on the back of your hand and then you were to drop some droplets of hot water onto that Vaseline, you wouldn't feel it very much. That's what it's like to have all of those secretions and everything pooling in your throat when you have a bad cold or you have a virus or you have any type of a flu. But what do you do to get that Vaseline off your hand? You need to wash it away. That's where drinking something hot comes in, for example, or cold, because it's a temperature that is going to help you to feel it more. I find with a lot of my patients that if they sip a hot drink, a water with lemon or honey that is soothing to the throat, it helps them to pull those secretions down and to be able to get rid of them out of the throat and feel it better. Of course, if you're on a thickened liquid, just make sure the liquid is thick a little bit in order to help pull those secretions down. So that's the neurological. Respiratory wise, then, because you have to hold your breath every single time that you swallow, it gets fatiguing. We talked in another segment about what it feels like to have a cold, what it feels like to have a pneumonia. And it requires a lot of effort to be able to breathe when you're not feeling well, just from the fatigue of the illness, but also the effort that it's taking. And this is where you can make a change when you consider the effort. For example, if it's taking a lot of effort in order to be able to swallow, slow down. Just give yourself time to reoxygenate because the breathing has to oxygenate your body, which goes and oxygenates your blood, which gives you the energy that you need. It's already diminished. You're getting less oxygen, so you have to give yourself time. Eat in fits and spurts. Eat a little bit, wait a little bit, then eat a little bit some more. Don't be in a hurry when you don't feel well. The other thing that you can do when you're respiratorily compromised this way is to put yourself in a position to give yourself the best advantage. For example, sitting up straight so that you're able to let your lungs expand and be able to get the most air in and out possible is the best thing. However, when we're sick, we eat in a recliner, we eat in bed, and our lungs cannot expand as much. But there's one simple idea that you can do. For example, let's say you have your kitchen table, or you have a table, a side table that you can, a tray table that you can put over your chair or your bed. If you put your elbows on the table, look what just happened. Just by simply raising my elbows, I have raised the lateral length of the area that my lungs can expand. Just from gravity alone, that's going to help me to breathe a little bit better. So if you want to get a little bit less fatigued, or let's say you have COPD or CHF and you have a virus, put your hands up on the table and see if that doesn't help. It's a little bit rude having your elbows on the table, but you may feel a lot better. The next system of dysphagia is the cognitive system of dysphagia. The cognitive system is not only understanding what you can eat and how it's going to affect you, but it's also the fact that swallowing comes from the central command of the brain. What that means is when you put something in your mouth, immediately a signal goes to your brain and says, it's hot, it's cold, it's sweet, it's sour. I have to chew a little, I have to chew a lot. It's giving you signals about what you need to do, and then your body is responding. It also says, how big do I have to open up the esophageal inlet in order to be able to swallow, how big that bite is? Or do I need to take multiple swallows because I put too much in my mouth? All of that is the cognitive process, the signals going back and forth from the brain to the physical functioning of the swallow. When you don't feel good, or when you have a virus, and also when you have a reduced oxygenation to the body, which is what happens when you have all of these secretions and all of this mucus in your lungs, it decreases your cognitive ability. Do you notice when you don't feel good, you're kind of cognitively foggy? That's why that is. You're just exhausted and your brain just isn't functioning as high as maybe you want it to be. Also, your swallow, it goes hand in hand. If you're not functioning as well as you should, it's not functioning as well as it should. Take that cue. What can you do? Really look at how you're eating and chewing and swallowing. Be cognizant. Be careful. Don't talk while you eat. Maybe get a Tervis tumbler and put a lid on it in order to be able to restrict the flow so that you don't choke on your liquids. Follow what your speech therapist says as far as diet texture is concerned, but just be careful. If you're caring for someone who's going through this, give them more time. Give them more verbal cues. Talk them through it. Not only will that help for them to be able to be more careful, but it's also going to calm them down because it really is creepy when you think about how hard it is to breathe with all of that mucus in there. Or if you were a previously very healthy person and now you have this virus and it's affecting your lungs and it's a feeling you've never had before, it's very disconcerting. So, talking to people, being able to help them, being able to help them calm down their anxieties, all of that is going to help the swallow. Which leads us to the last system. That's the gastrointestinal. The gastrointestinal system, when you swallow, food is supposed to only go in one direction. It's supposed to go through the mouth, through the pharynx, into the esophagus, down into the stomach, and stay there. However, the statistics are phenomenal with how many of us have reflux. Reflux is when it goes down, mixes with acid, and comes back up. And then it can drop into your airway in order to cause a acid burn, if you will, into your lungs, which makes it even more hard or more difficult to be able to breathe and coordinate that swallow. So, what can you do? Well, again, there's a couple simple things you can do. Number one is watch the acidity of the foods. Maybe when you're not feeling good, try to stay with some things that are a little more neutral. Two is your positioning. If you're slouched over while you're eating, you're creating more area for the reflux to come up because you're pushing on the stomach. Trying again, maybe put your elbows on the table, which will help both ways. Swallowing and giving yourself a chance for the food to go all the way down and going slow might help. Sitting up for at least 2 hours after you eat so that the food has a chance to stay down. Maybe in your recliner, if you're sitting in a lazy boy, sit up. Don't immediately lay down after you eat. And if you are in bed, again, make sure that maybe your arms are on pillows on either side and you've got 2 or 3 pillows behind your shoulders and behind your head to be able to help keep that food and liquid down. So that's the 5 systems of dysphagia. And as you can see, it's a very complicated process. When something goes wrong, such as getting a virus or aspirating and having your respiratory capacity be diminished, you can see how it can throw everything off. We're here to help you. Your speech therapist in your facility or local speech therapist is there to help you, as are your nurses, the physicians, the whole healthcare gamut is here to be able to help you feel better. Stay tuned for more episodes of DMS Cares. This is Carol Winchester, and thank you.